a child age 2, 2.5, 3, 3.5, 4 to be tagged as autistic, and then we need to do something for that child. And unluckily, the worst part of it is that once a child is tagged as being autistic child, the child is now sent to special education centers. The child is now sent to psychotherapists for OT, for speech therapy. And even if a child could have easily come out of that phase, going to those artificial setups, looking around and having so many other kids who are autistic, who are making blabbering sounds, jargon words they are using, the chances of a child quickly improving and coming out of that autism further go down. So that is why it is very important for you as a parent to understand that if a child is not verbal and is not verbal at a very tender age, rather than waiting for someone to tag that child as being autistic, it becomes so important to work in the right direction and ensure that the child comes out of that phase. So that is why using the herbs which can improve the speech of a child are so important. I'll be coming to all of your questions. Your questions are really very important for me and for us. And your names are there, your questions are there. And once I complete the topic, which is very important topic for us today, I'll immediately be coming back to your questions. So moving ahead. Now, once a child crosses 4.5 years of age, now what happens? Now a child crosses 4.5 years of age. Now this is the approximate age, which is the age of reflex language development age going away. Once a child crosses 4.5 years, now the reflex language development which was to occur in the child, now that age has gradually gone away. And now it is a age where a child can be trained for a language. And that is why when our children go to schools at this age, at a particular age, they are introduced other languages. The teachers, they teach them those languages, and yes, the child is trainable for those languages at that age. But if we say that a reflex language development is going to occur at this age, no, that age is lost. That is why when a parent comes to us after the age of 4.5 years, and now the child is non-verbal or is using very less words, it becomes very important now to make the child focus, because many a times by this age the children, they will become hyperactive, they will lose focus, they will not concentrate. So that is why when a child above 4.5 years of age comes to us for a language development, what I always tell the parents over there is that, see, we will firstly have to work on hyperactivity if the child is hyperactive. We will have to work on the concentration span if the concentration span is low. We will have to work on the command following if the command following is low. So those are the things which firstly need to be addressed, as in most of the kids those problems have gradually developed with the growing age and without usage of language in that particular child. So that's why the right herbs which we use after 4.5 years are generally the herbs which are there in Breno R. So let me show those herbs to you. And when I talk about those herbs, as you can see on your screen, Mandukparni is one of them, Kushman is one of them, Ashwagandha is one of them, Amalki is one of them, Jatamansi is one of them, Sarpagandha is one of them, Ustakhadoos is one of them. And as you can see, these herbs are almost entirely different from the herbs which were being used below the age of 4.5 years.
Autism is a temporary phase in the life of a child if treated timely.
A patient name, Moksh, patient age, 6 years old, disease, autism. A chief complaints, hyperactivity, aggressive behavior, speech delay, deficit eye contact, lack of attention. A history of patient. Moksh's parents consulted Dr. Navdeep Sharma for his autism treatment. They discussed about the chief complaints. They started the treatment after being convinced for the same. Interacting with Moksh was challenging as he had difficulty understanding and rarely engaged with those around him. Moksh struggled with speech delay and often seemed lost in his own world. His hyperactivity and irritative behavior made it hard for him to connect with others. After treatment from ND Care by Dr. Navdeep Sharma, Moksh has started using words to express himself, and his speech has improved significantly. Moksh is now much calmer and more focused. The hyperactivity that once overwhelmed him has reduced, and he's more at ease. We're seeing a new side of him. He's interacting more, engaging with those around him, and forming meaningful connections. His understanding has grown remarkably. He responds better, and everyday moments now feel filled with progress and joy.
Hello, my name is Pooja. My son's name is Moksh. My son is 6 years old now. When he was 3 years old, he was diagnosed with autism. When we consulted the doctor, they said that there is neither any medicine nor any cure for this. So we were very worried. My child was very hyperactive. He had no concentration, no attention, and he lacked eye contact and toilet training. We were constantly worried. Then we learned about Dr. Navdeep Sharma, so I contacted him. We started my child's treatment in November 2022, and gradually my child began to show a lot of improvement. My child's understanding improved, his eye contact increased, and now it's been almost 2 years. My child has almost recovered. Thank you so much, Dr. Navdeep Sharma. Thank you so much. You have almost cured my child. We had lost hope that my child would ever get better. Thank you so much, and above all, I want to thank Tina Mom, who is our coordinator. Mom has always motivated me. Thank you so much, Mom and Rahul sir, who have always guided me on how to handle the child, how to do activities with him, and how to deal with the child. Sir explained to me, and because of that, my child's sitting time has increased and his concentration has improved. Now his hyperactivity has also reduced. My child now recognizes everyone. Earlier, my child used to go to a special school. Now he is studying in a regular school, and I am very happy. Thank you so much, sir. Thank you so much. Thank you so much, Tina Mom. Thank you to the whole team of ND Care.